Hello, welcome to the antimicrobial group of drug side effect. Yesterday we have seen the antibacterial group of side effects. So today we are going to see the antiviral group of drug side effect. In this we are going to see the first drug is, we all popularly know, the Acyclovir, right? So this is about the Acyclovir. Acyclovir is causing crystalluria and neurotoxicity. It is a drug of choice for herpes and cytomegalovirus. Only very few drugs we always remember, even with the dosage and the frequency. One of the drug is Acyclovir. So hereafter we try to remember the side effects too. So this is causing a crystalluria, thereby causing obstructive renal failure and also neurotoxicity. So it is causing seizures. Then the second drug is Acyclovir. It is causing a bone marrow suppression. Acyclovir is a drug of choice for CMV, cytomegaloviruses, and then Cidofovir. Cidofovir is a drug of choice for recurrent laryngeal papillomatosis, right? Side effects are nephrotoxicity, Fanconi syndrome, and anterior uveitis. Whenever we are encountering any kind of ocular side effects, we try to remember, because it has its own significance, right? So we try to remember anterior uveitis, Cidofovir. Then there comes the idoxuridine, which causing the cardiotoxicity, and trifluoroiridine, again punctate keratopathy, right? The another one important drug is foscarnet. We always remember the Acyclovir, but we'll forget the foscarnet. But actually foscarnet is a drug of choice for resistant herpes. Foscarnet is having humpty amount of metabolic derangements. See here, either it can cause calcium increase or decrease, either it can cause calcium phosphate increase or decrease, but it will decrease the potassium and it will decrease the magnesium. Here you can see hypocalcemia or hypercalcemia, hypophosphatemia or hyperphosphatemia, hypokalemia, and hypomagnesemia. So all these metabolic derangements are resulting in nephrogenic diabetic insipidus, because its own pathogenesis on the kidney. Then again the next drug is fomiversin. Fomiversin is always given through intraocular route, so it can have its side effects on, obviously, on eyes, right? So retinitis, cataract, and vitritis. And here comes the amantadine. Amantadine is having one significance. This amantadine is given only to the people who are known sensitive cases of influenza, because the side effects of amantadine is ankle edema and livedo reticularis. Right, just for getting treated for a flu, you are getting ankle edema and livedo reticularis is unfair, right? So amantadine is given only to the people who are known sensitive cases of influenza A. And then there comes the oseltamivir, which is a very popular drug in this pandemic situation. It is causing nausea and vomiting, so you always have to take with the food. Like the Acyclovir and the foscarnet, here is another one abandoned pathetic drug, that is zanamivir. Zanamivir is actually a drug of choice for oseltamivir resistant flu and some bird flus, right? So zanamivir is having a side effect of bronchospasm. Then there comes the interferon alpha. It's actually increases the viral degrading enzymes, thereby it decreases the protein secretion. This is the mechanism of action of interferon alpha, and this is quite commonly used in hepatitis B, C, D, like that. So side effects are bone marrow suppression, hypothyroidism, and flu-like syndrome, right? So these all are the drugs about anti-herpes and anti-flu drugs. The upcoming drugs doesn't need any kind of introduction, because zidovudin, lamivudin, nabakavir, efavirenz, all these are quite commonly used in India for HIV. So these are the anti-HIV drugs. Before we are entering into the anti-HIV drugs, I want you to remember two important rules about the HIV drugs. The first one is, all the anti-HIV drugs are excreted by kidney except zidovudin and protease inhibitor. These are metabolized by liver. So obviously the side effects will depend on the liver, hepatotoxicity for zidovudin and protease inhibitors. So the first rule is, all the drugs are excreted by kidney except zidovudin and protease inhibitors. The second rule is, just because protease inhibitors are metabolized by liver, it is all the PIs are having hepatotoxicity. So these are the two rules we have to remember. So coming back to the zidovudin, this is a nucleoside reverse transcriptase inhibitor that is excreted. It is metabolized by kidney. Metabolized by liver. So this is having a hepatotoxicity, myopathy, insomnia, lactic acidosis, and bone marrow suppression. Hepatotoxicity, myopathy, lactic acidosis, additionally insomnia and bone marrow suppression. Right. The second drug we are moving into is tenofovir. Actually, tenofovir is, as its name suggests, T for T, like that we'll remember. It is the only nucleotide reverse transcriptase inhibitor. All are nucleoside, this is the nucleotide, T for T, tenofovir. So, this is having a nephrotoxicity, Fanconi syndrome, bone resorption. So, it is contraindicated, obviously contraindicated in renal failure. Again, there is one contraindication, that is if there is age less than 10 years or weight less than 30 kg, tenofovir shouldn't be given. Right, then again didienosin causing pancreatitis, abagavir is causing myocardial infarction and Steven Johnson syndrome. All the non-nucleated reverse transcriptase inhibitors are having rash as the most common side effect. Apart from rash, these efavirenz and nevirapine is having some significant side effects. Efavirenz, as you can see the symbol, right, it is contraindicated in pregnancy, but in India we are giving efavirenz to the pregnant ladies. Why? Just because the benefits of the drug are outweighing the harmful effects of the drugs. So we are administering the efavirenz to the pregnant ladies even though it is contraindicated, just because these the good effects of the drug are outweighing the harmful effects of this drug. Right, then nevirapine we quite commonly used to prevent the perinatal transmission, right? So nevirapine, but this is causing a fatal hepatotoxicity. Then again raltegravir, dolutegravir, all are Vir group of drugs, which means all protease inhibitors, right? So the Vir group of drugs again causing hepatotoxicity, especially raltegravir, R for R, raltegravir is having a rhabdomyolysis. Then again the rule, all PA inhibitors are having the hepatotoxicity. Again one rule, all PA inhibitors are having a metabolic side effects too, like dyslipidemia, hyperglycemia, central obesity, buffalo hump, like this. But there are exceptions, except atazanavir. So this doesn't cause dyslipidemia, right? So last two drug is indinavir. Indinavir is having a crystalluria nephrolithiasis. The same acyclovir is having a crystalluria, right? Like that, indinavir is also having a crystalluria nephrolithiasis. The last one is tipranavir having an anticoagulant effect, right? Thanks for watching.